Okay, can you guys still hear me?
Yes.
Good.
Yes.
And then I need to find the file. Oh, quick access, it should be here. There it is. Ooh, we're getting there. And okay, somebody had a question. Yes, I can hear you. I can hear. Excellent. Thank you, guys. Thank you. Okay, it is recording and we are good to go. Excellent. It's only 6 minutes late. Sorry about that, guys. Welcome to our MOTS Client Entry Webinar, April 7th, 2021. And I was looking forward to spring, but today I think it's a day on hold, but it should be coming back soon. So welcome to our webinar. For those of you not that familiar or newish with the webinar, they are recorded. And in that little pop-up panel that started when you joined the webinar, there is a box where you can type in your questions. And I'm here with Mary and Lyle, Justin, and Jody. And hopefully we can answer the questions that you might have. And if one of those questions we think that might be interesting for everybody else to share, we'll bring them onto the PowerPoint floor and we can discuss it and talk about it a little more if we think it might be pertinent. As I said, this webinar is recorded. We record all of them and we keep the last two on our website. So that is kind of what how the thing works today. So why don't I get going with the purpose? Why do we do all this? If it is clicking, is it clicking? Yes, it is clicking. Well, of course, to give you information on changes and enhancements, because you've probably heard this one before, but the only constant is change, because there's always going to be changes. There's changing of systems, changing of people, environments. There's all kinds of things going on always. Sometimes a lot of changes happen. Sometimes for a while, nothing happens. But if you're kind of a little bit familiar with the way we work, as soon as there's anything, we'll definitely let you know and try to keep you informed on all the things that might happen. Data issues are very, very important to us. We try our best, and we know you guys do too, to get the best data that we need for all our decisions, for the work that everybody does, for all the treatment providers to improve the quality of the work. You can make better decisions if you have better information. So that's why if there are any data issues, if there's some stuff lacking or some stuff missing or stuff that we need to expand on, then we'll discuss it here. Your feedback is also very important. Like I said, you guys do the work. You work with our systems, you work with us, so you know what works and what doesn't, and what is good for your organization and what might be helpful to your organization. So it's very important for us to get your feedback. So, and maybe one of those issues that you might discuss, we put it on one of our future webinars and make it a topic and expand a little bit on it and try to talk a little more about it. And of course, if there are any questions right away, and I see a question pop up, but maybe that's the old question that I hadn't seen. And then, yes, there you go. Okay, no, it's all good. And answer all the questions that we have. So sorry about the little delay. There were some technical issues that happen sometimes if you work from home. These things are not as smooth as they are at the office, but maybe the discussion at the moment is that maybe by the end of summer, things will go back to a little more as we were used to. So normal, I don't think we'll get back to that, but or whatever your definition of normal is, that might change again anyway. So, okay, get back, and then I'll give the microphone to Lyle, who's going to talk about a new URL. New URL. What's that, Lyle? Go ahead.
Good morning, everyone. So the MOTS web portal is going through some backdown upgrades. If you're a technical person, we're upgrading Cold Fusion. That probably means nothing to a lot of you. But what it really means to all of us as users is that in the next couple of months, MOTS will just change its current URL. And we'll need all of our users, including myself and everyone on this line, to update their bookmarks. We will send out a timeline for them in the MOTS Messenger of this whole process, so you'll know the exact dates and the dates of the changeover, and there'll be lots of communication. This is pretty early on, but I wanted to just let you know. And to ease the transition, the old MOTS URL will direct to the new MOTS URL. So if you use the old MOTS link, it'll take you to the new MOTS URL, and just update your bookmarks. And I want you to know nothing about MOTS is changing. This is just all in the background. MOTS will look the same, have the same functionality. This isn't a new MOTS or anything. It's just some changes to the code, just all in the background.
Excellent, thank you, Lau. That redirect from the old to the new, how long does that usually stay up? Any idea?
We're hoping 6 months to a year. So we're trying to make it a long time.
So no rush. So we can bug everybody a lot of times, like, hey, we have a new URL. Did you get a new bookmark yet?
We'll be bugging all you guys a lot about it.
Excellent.
Hopefully we won't annoy you with reminders.
That's our specialty, right? Thanks, Lau. Okay, I received some performance charts from Justin, who is our report specialist, and he gave me some data, and I kind of transformed that into these charts. And some of these charts might look a little bit familiar, the one on the left and the one on the right, maybe not so much, but I kind of put them both out there to give you a separate view. If you look to the one on the left, it says percentage equals facility. And then in the middle, it says not updated. And then the NNN, which means the number, is the percentage of clients. So if you look on the big blue blob on the left, the piece of the pie that's nice and blue, and it says 0 and it says 40%. Well, if you see 40%, that means 40% of the facilities have, and right above it is a 0, so that's the number. So that's the number of clients. 40% of the facilities have 0 clients that have not been updated for the last year. So that's a good number, because it means you keep them updated, and maybe not every quarter, but at least every other quarter or so. So the numbers are looking pretty good. On the other hand, if you look at the other big piece, because there's a lot of small ones at the bottom right, but there's another big piece on the right that's very red, that says 27%, and it says 100. Well, the 27% means 27% of our facilities, which is a good chunk, 30%, have not updated 100% of their clients. So what's going on there? And I was a little surprised with this chart as well, that there are that many. I know there are certain facilities that are in the process of being closed, and there's a couple of clients out there that we're struggling with, and there's some issues, or there's transition going to a different system, or going from CE to EDI. So there's a few stragglers out there, so that's why but it's 30%, and I thought that was quite a bit actually. So, and as you can see on the one on the right, the chart, that it is the big chunk, is the biggest chunk, of course, is at the bottom, is doing great. 0 clients, haven't been updated in a year for almost 97 facilities, because these are the number of facilities. And up on the top is 65. So we're really dealing with all or nothing. So if you're in, you're in, and if you're not, then not so much. So hopefully we can change that, and that is one of the things that we're trying to do with communicating with everybody and trying to give information. So one of the things that might result from this research that we did, because we like to dig into our data and see what's out there, is that for those of you, for those facilities that are out there, and maybe it is one of the reasons could be, and that's why I have the next report, is that the active client reports, it is sent out every first of the month, of every month, to a particular individual, the agency facility contact. So the primary contact that we have for a facility will get this report. And we also know that there's changeover in our business. So maybe the person getting this report is not working there anymore, or they are doing a different task and forgot to transfer this responsibility to another person who's currently in charge of data quality or data entry or working with the information. So if you are not familiar with this list, and you might be approached by us, then maybe you can contact us. We can take a look into the system to see where this report goes to, and if it's not the right person, we can make the change. Or maybe you can find out who that person is, and you can contact that person within your organization, say, hey, I've been hearing about this report that's going on, the active client report. Can you give me a copy or send me a copy so I can work on it or share it with the organization? And hopefully that all that red, and as you can see, there's quite a few red ones out there. There's 4 colors. There's red, orange, yellow, and green. If it's green, great. But if there's red on there, you might want to check to see what's going on. Because we know it happens that individuals come into treatment and they start, and then halfway somewhere they disappear, and they never really are closed, and they say they're coming back and they make a different appointment, but they just kind of keep hanging there, and you might forget about the individual. So that's also what this list is. It's a monthly reminder to see how the status of all the individuals are and see if everything is working. So okay, and that is all I wanted to talk about today about this performance. Let's take it back and give the performance to Mary, who's going to talk about a new P number form. Here you go, Mary.
Okay, thanks, Pete. So in order to do client entry into MOTS or to look at your facility or agency contact screen, you need to have a P number, and each user of MOTS needs to have a P number. So we've had various forms that we've used to sent to you for you to fill out and send back to us. And we have just updated that form. And it is, so this is a screenshot of the form that we are currently using. And we've made it so that it is, you can go in and fill in, type in the information. And the reason why we did this is because we get requests for P numbers not only for MOTS, but for other systems that we manage, and one being the acute care system. And we are currently working on the new database system for gambling. And so down at the bottom, you'll notice that there's this asking which program that you want to use. And when you click on one of those programs, such as MOTS, it'll open up and it'll show the various access levels that a user may have in MOTS. Those 3 being admin, write, and read. And the admin, when a person has admin access, they not only can add clients in client entry, but they can also go to either their agency or their facility profile pages and update like contact information. So you could go in there if you wanted, add a contact, a person to be a contact for MOTS. You can say, I want the reports to go make somebody the primary contact for your business. And so it's very useful, right? You have access to make client entry, you can, or read access. You can go into client entry and you can look at somebody's current record that you have for them in MOTS. And the P number form is to be used for when you need to add a new user, or you have a user that has a P number, but for some reason that they're disabled. So in the Active Directory, and the process for either a new user or reinstatement of an old user, it takes about 10 business days to complete. So that's all I have to share.
Cool. Thank you, Mary.
All right.
I'll check to see if there's a question that popped up there. Looks like there's a question. Should facility contact for MOTS have record of all P numbers for users at their agency, or is that not necessary?
Can you repeat that?
Sure. Where is the question? I think it's a good question. Where was it? Plop. Let me pull that out. Should the facility contact for MOTS have record of all P numbers for users at their agency? I think that's a very good idea to keep track of those numbers, because we know there's turnover in our business. So if the facility primary contact will take the responsibility and keep tabs on the comings and goings of individuals, that would be great. Yes, that's an excellent idea. And then
you can. Jody's asking who has the P number. How do we find out who has the P number in order to start that list? Just send us an email at MOTS Support, and we can look that up for you.
Always a good spot, MOTS Support. We'll get to that in a little bit. Thank you, Mary. Are there more questions? Anybody that, or are they being answered? Somebody raised a hand.
Oh, where is this form located? I believe it might be located on our website. If it isn't, I will ask that it be put on there. And you can also email MOTS Support and we can send it to you.
Excellent question. Thank you, Mary.
Okay, if we have staff who left, we need to let you know to have their P number removed. Yes, that would be a good idea. Also, if you have administrative access to MOTS, you may be able to go in and deactivate the users yourself. But yes, it would be a good idea to let us know so we can update our records. And I think on the form there is a box besides is this person new or reinstate. There's also a box to say deactivate it, and you can let us know on the form that they have left your company.
Correct. Yes, there is actually a fee connected to this P number. For each P number that our organization has, there's a certain fee. So if we can deactivate an individual and give that number back so it can be reused by not any person from any system within our organization, that would be a good thing. That could save us some money. That's just always good. I don't think it's a big fee, but every penny helps, right? Okay. Let's take you back to the Compass future. And I forgot to do that. Sorry about that. You might have heard or you might have seen messengers or announcements from different systems about all the things that are going on in our organization. And one of the things is that there's talk about the whole Compass replacement project. And part of Compass, of course, is MOTS, because Compass is the whole team. And a lot of us do MOTS support, but we also do more. We have other systems like gambling and ACR that are, ACR is currently up and running. and gambling is in the process of being developed. So those three systems are currently they're all part of the Compass systems. So one of the things that we have been talking about, and those plans are out there, to upgrade our current system. Lyle already mentioned in the beginning that we are using Cold Fusion. Cold Fusion is a programming language, and that might not mean that much to anybody, but the same as COBOL was a programming, and there's all kinds of Pascal and plenty more of these systems that are out there. But Cold Fusion is a bit outdated and not so popular anymore, so it's very difficult to get individuals to work on this system. Plus, when a system gets outdated and new systems replace it, the support for the software goes down, and it's harder to maintain that system. So that's one of the reasons why we keep going to new systems, because I know it sounds a bit tough, but we always have to do that. So that's how the organization and how the IT world works, actually. So we are working to trying to decide if it's going to be a new system built by us, or if we're going to make it, if we are going outside and putting out a request for proposal, an RFP, and organizations that think they have a good system for the state, for us to replace what we currently have, then we might go that way. So they're working on that at the moment. So one of the things that we'd like to do, and why we are talking about the Compass replacement, is to get all the systems together, integrate all the behavioral health systems. And as I mentioned earlier, the MOTS system, the gambling, ACR, but there's also certain parts of our organization that deal mainly with children, or another part that deals mainly with seniors. There's no real system for them out there, not a data entry tool or an automated system. We had a kids survey system for a little while, but that it was kind of outdated pretty quickly and pretty cumbersome, and not giving the right information that part of our organization was working for or looking for. So we might get a system that has a special section or a segment or part of their system that is specifically set up for just gathering children information. And the same goes for seniors. So we were hoping to maybe either, like I said earlier, maybe we're going to build all that, and we're going to build on what we currently have with ACR and our gambling, or PGNet as they tend to call it. The problem gambling.net is the new programming language. So hopefully we can get all those systems in there. Another thing that we are working on as part of the Compass replacement is all existing spreadsheet reporting. And it says reporting there, sorry about that. One of the things that we tend to do as our organization is when something happens, when there's a new legislative thing happening, or there's a new grant that somebody picks up, of course, to monitor what's going on with that new legislative decisions, or that new law that gets into place, or the new grant that we picked up somewhere, we want to monitor what's happening, if there's any changes that to make sure that it's a good thing that we're doing, that we are using that money wisely that we get from that grant. So we want to report on it. And a lot of times what we do is we go the easy way and we say, oh, we'll just design a quick spreadsheet with some columns and some headers, and we'll send it out to everybody, and you just fill it out once a quarter, once a month, and you'll just send it in and we'll get that information, because that is the one thing that everybody has their own control, and it works quickly and it works easily. But it's not the best way to do it, because of this, and we've had this mentality for a long time, but it's also one of the choices that we made, that I've heard that we've had over 1,500 different existing spreadsheets for a while, and that is way too much, because that's a huge administrative burden for you guys, because you might not know it, but there's different people within your organization that might be different pieces, or maybe you're the one kind of have to deal with all these spreadsheets on a regular basis. So what we're trying to do is get one system with all the information in there, and enough information to be able to deal with kind of like ad hoc requests for basic information about the children, seniors, behavioral health, gambling, acute care, and all that stuff. So one of the best answers that I currently have is we don't know. And because we know that there's a lot of information going out, and a lot of people are asking us, when is it going to happen? Do I have to worry? Do I have to change? Do I have to do anything? No, nothing. What we'd like you to do is, if a survey comes at your desk or just shows up in your email box, please answer it. Take the 5 to 10 minutes, because they're usually very short. Answer them and submit them to us, because the more we know about what is important for your organization, what is working and what isn't working, the better we can design and work with our new systems, and the better we can make a better future for Compass. Thank you. Any questions about that we should answer, or are they all answered? Take a quick look.
The only thing I would add, Pete,
Yes,
is just for everybody on the call here is, you definitely need to continue reporting to MOTS until you are, informed otherwise. There had been a little confusion and some feedback we got that individuals thought, because we were replacing the system that, or looking at replacing it, that they didn't have to report anymore. So keep reporting through the current method until we let you know that things will be changing. And as Pete mentioned, we will be giving a lot of advance warning and notifications and involving all of you in our project. So I just wanted to add that in, Pete.
thank you, Jody. Yes, oh, definitely. Keep doing what you're doing. Keep up the good work, because as you know, sometimes it can take years before something really changed, because the government, unfortunately, can still be a bit slow, but we have to jump some hoops because of the way we are set up. So thank you, Jody. Okay, then, well, speaking of Jody, switching from CE to EDI. Go ahead, Jody.
All right. And for those of you that are here on the call, normally this is the last topic. So if you typically are like, I've heard that, and I'm going to kind of, bounce out, stick around. We still have one more topic. So anyways, so yes, so if you are looking, even with COVID going on, and the last year that we've had, a lot of organizations are implementing new EHR systems. They're looking at going from client entry to EDI. So we just wanted to recap what the processes are in order to do that. So the first biggest thing is to please notify us. Let us know. Even if you're thinking about it, it helps our teams to understand what's coming down the pike, if there's anything we see that you might need to be aware of as you move from client entry to EDI, and we can make sure that we have the resources available to support whatever direction you're moving in. The next thing is if you're looking at new EHR systems, one of the important things is there's many different ways that systems send the data and utilize the EDI process. So if you're looking at a new system, or you're looking at how your existing system might be developed to report through EDI, make sure you understand how that process is going to work. If you're looking at and you're getting a demo of a new system, ask them to show you the MOTS process from intake to actually reporting to MOTS. There's many different ways to do this. There's no one right way or wrong way, but it definitely helps you as an organization to understand that there still usually is some staff time that's going to be required. Then you're going to be able to figure out who does what, and it really helps you to understand if an organization or the system is saying, yes, we have MOTS functionality. Just understand it fully so that you have the right expectations for you and your team as you move forward. Number 3, project timing. Again, letting us know and letting us know what your timing might or might not be. We know that those change is important. And we understand if you're like, hey, we thought we were going to be changing in October of this year, but you know what, we pushed it out into quarter 2 of 2022. No problem. Just let us know. We will go over the process once it's determined that you are going with a particular system or implementing your existing systems method for submitting. We will go over that process to go from client entry to EDI. For those of you that may be unfamiliar, the EDI process works basically an electronic file gets sent to us and a secure file transfer protocol. You may have heard SFTP. We set that up. It's a spot on our servers here that your files come into, and it's also where our information on how your file did comes back to you. So we set that up. We also look at your client IDs. You might be needing to update those because sometimes when you go to a new EHR system, they have assigned ones that will be coming in. So we'll talk about that and go through the steps if we need to assist with you changing those and updating them. So it's really important just to define your business processes. This is an internal thing, but it's just kind of lessons learned that we've found from others, that if you define those business processes and workflows when you move to a new EHR or to EDI, it just helps you and your teams to get into a flow and a synchronicity of sending data to us. We're going to test your files through EDI. So if you're looking at different EHR systems or EMRs, and they say, well, we report to MOTS already with other customers. We actually test the files at your provider, you as an organization, your level. And the reason we do that is because there's so much customization, which is amazing for folks that are, trying to get what works best for them. With those customization pieces, we just want to make sure that your files, everything is mapped correctly and everything comes through right. So we will test at your agency level. We're going to go live, which that's always super exciting to actually be submitting the EDI files. And then we will do some follow-up, and that basically we have found helps with organizations as they go live. The follow-up is could be a weekly meeting, it could be bi-weekly, it could be whatever your organization feels is appropriate, but it's with myself typically or somebody who is, filling in for me or is assigned to your project. And we just talk about how it's going, what you're seeing, how your files are processing, what's going good, do you have questions, and the follow-up have been really beneficial to make sure that everything's going smoothly. So I do predominantly the EDI support on the MOTS Compass team, but I do every once in a while help out with some client entry. So I'm excited to work with any of you that will be switching or that reach back to me. So again, thank you all for attending today and taking the time to be here. We appreciate it.
Thank you, Jody. Take a quick peek to see if there's anything popped up in the question. I'm not seeing any questions that I can answer right away. So, okay, let's take it back to the agenda. And as Jody mentioned, there's one more item on our agenda. And in the meantime, Jody and the rest of the team can look at the questions. One thing I'd like to talk about is non-Medicaid services. You're probably all aware of the non-Medicaid services. The way we have our organization set up is we have our behavioral health status data, which is your basic demographics and diagnosis and stuff and everything, location, all the demographics that you can think of, we have them in there. And then the other part of the data that we request is non-Medicaid services. The way it works is that there are specific reasons for when to submit those services. The group sessions, the psych evaluations, the UAs, all those little things you guys do, that the majority of those services will be submitted as a claim to Medicaid. You'll be sending a claim and you'll get reimbursed for that. And because 85% of our clientele for the behavioral health world that we see is Medicaid and Medicaid eligible. So almost all of those services will be sent as a claim to Medicaid. and you'll get reimbursed for that. But there's some few exceptions. There's new grants, and the whole COVID crisis has thrown the world a little bit upside down here and there. New programs, new types of services. There's telehealth, there's teleworking. A lot of things have been changed, and a lot of people say, oh, we only do OHP, so we don't have to send them. But there are some services that are non-Medicaid that need to be submitted because maybe your client isn't eligible for all the particular services that you are providing. Maybe the majority, but there could always be one or two exceptions. So for those that are not coming back with a financial reimbursement, that are denied, claims that are denied, or just simply because they're not eligible. So some stuff that you finance through the general fund that you have in your organization. I know this is a bit of a billing subject topic that we talk about, but because of that, you might want to check to see if everything goes out and where everything goes, because like I said, OSP only doesn't always tell the whole story. One of the greatest tools that we have, and I always like to show that at our training that we used to do, is this little chart, this little graphs, who can help you decide if the particular services that you are providing needs to be reported or not. So those things on the left, those decision diamonds, you always start at the top. Don't say what if, but here or there, and start in second or third. Always start at the top. You have provided the service, you run some UAs for an individual, and you say, okay, this procedure, is that funded by Medicaid OHP? If the answer is yes, you should, because they have a Medicaid card and they claims will be submitted, then you don't have to worry about it. But if the answer was no, it was declined, they're not Medicaid eligible, or they're kind of like different funding streams that are some grant that is paying for the particular service, then you have to ask the next question. It takes you to the second decision diamond. Was this particular service for DUII or methadone? If it is a DUI or methadone service, then yeah, and the answer is yes, then you have to submit to AMH as a non-Medicaid service. And some people ask about it. Well, that makes a lot of extra work for me, but the way we have it set up is that it's 4 or 5 different fields. It's not that many. Plus, we have a calendar date on there. And I apologize for that phone call coming in. We have a calendar date. And in that calendar, you can select multiple dates, because usually a particular service that is not Medicaid and the person is not Medicaid eligible for happens several times during a month. So if you go at the beginning of a month and you review the last month, you put those 4 or 5 items in the non-Medicaid service file, and you pick those dates, you hit submit, and it'll fill out the whole calendar, and all those services for the last month will be there. So we've tried to make it as easy as possible to make sure that there's no real administrative burden for you. So if it is DUI or methadone, sorry, let me get back. If it's not Medicaid, it is DUI or methadone, yes, submit the service to AMH. If the answer to the question, is it DUI or methadone, is no, then you go to the third question. Is this particular service funded by private insurance or 100% private pay? And if the answer is yes, then you don't have to report it, because it's 100% private pay or 100% private insurance. If there's bits and pieces, then the answer is no. But if it's 100% and then yes, okay, go ahead. If the answer is no, then you have to submit it to the AMH non-Medicaid service reporting. Those are the questions that you have to ask, these 3. And you might want to go through that with somebody from the billing part of your organization, sort that out, and you'll get a feel for which services need to be reported and which ones don't. So you might figure out a way to set it up, say, okay, these services we do send to MOTS, and those we send to Medicaid as claims. So hopefully you can sort that out. Are there any questions about that? I see some stuff popping up, but Let me pull that back up. Still about the P number. Okay. Cool. Any questions, guys? Because now it is Q&A time. Everybody is very quiet. That I'm assuming there's no questions or nobody is with me anymore. Am I still here? Oh,
yeah, I'm here. So I'm here. I'm replying to a few of the questions that were on here. So I don't know that there's anything that needs to be for the entire group, although I'm not the bottom of the questions, so we may need to look there and see, or maybe you've already done that.
I kind of looked through it and I don't think there's anything new, so thank you. But it's always funny because you just keep talking and you don't hear anything, and sometimes there's a connection lost here or there. So, okay, Q&A. If you have any questions, or maybe not right now, but they might pop up later, or when you share the video of the webinar that we posted with somebody else, or somebody else has some questions, always you can go to mots.support@dhsoha.state.or.us. As I mentioned, the webinar will be posted on the website, and you can also go to the MOTS website for the latest 12 editions of MOTS Messenger. Yes, go ahead.
So there is one question that was in reference to the non-Medicaid services. It says, I have been given mixed information about non-Medicaid services. Am I to enter all behavioral health patients in MOTS? So
yes. My first answer is always yes, because first make sure they're in MOTS. MOTS has two components. It has the status and the non-Medicaid service. Your clients all have to be in MOTS, no matter what. The non-Medicaid service, there's the questionnaire that I showed. That's what I was trying to sort out. So the actual treatment episode with the start date and admission date, and then an active status, and then over time, hopefully a completed status or a transfer status or something like that. Those all have to be in there. The non-Medicaid services, that might be a question. The three questions that I showed in the little chart. I hope that answers the question.
Yeah, I think so, because, as Pete mentioned, you have two sections. Everybody needs to go into, all behavioral health clients need to go into the status part, where you're entering in their episodes and their diagnosis and all of that. But of course, the non-Medicaid services, that's why you use that chart to determine, are they getting services that aren't covered by Medicaid? And if so, then I need to put those in that section of MOTS.
Excellent. Thank you, Jody. Okay, recording will be there. The website, we have a year's worth of MOTS Messenger, and it also shows the dates for the future webinars. The next one, with the focus a bit more on EDI, today was client entry, will be on May 5th, 2021. Unfortunately, there's still no classroom trainings. They're still canceled until further notice. However, if you would like some more training, or you have some co-workers or a new person coming in that would like to be trained on the MOTS system, there are two options. One is the videos that we have on our site. For actual, each individual segment has its own little video, or we can give you a walkthrough. Lal and myself do trainings. We set out an hour and a half. We'll set up a go-to, and we'll do a one-on-one or one-on-two if you have two people watching it, sharing a computer somewhere, and then we can kind of walk through and show you all the ins and outs of the system. So, okay, that was that. Any more questions that I missed or that we think need to be here?
I don't see any that I'm aware of, because we answered that one. And I will have to say, really appreciate all the interaction and questions from the group today. You've been very, pretty active and participating, so you're obviously engaged. So thank you. No, Pete, I think we have it all here.
Great. Thank you, Jody. Thanks, everybody else. Thank you for joining us today. Like I said, if something pops up, mots.support@dhsoha.state.or.us. Thank you very much and have a wonderful rest of your day.